Sorry, my lab assistant misplaced this. Silly Colin. My name is Scotty Wagenblatt, here to talk to you about APL, or acute promyelocytic leukemia. The symptoms of APL are bruises, paleness, fatigue, and unusual bleeding. This disease affects about 10% of all Americans. APL is known as the most curable cancer or subcancer. Come with me to learn about some facts about it. APL. Find someone who might be affected by this. Thank you.
Good afternoon. This is Leroy Brown here to tell you about personal facts involving APL. The symptoms are unusual bleeding, bruising, paleness, tired and breathlessness, frequent infections too. Victims of APL may know whether or not the gene for acute promyelocytic leukemia is in them, but APL symptoms do not start until birth. Acute promyelocytic leukemia begins when bone marrow starts to produce too many white cells. Certain medicines cannot cause an APL patient to lose their hair from chemo or radiation. By this, the bruises that patients receive and more are more prone to infection. With this disease, there are 10 to 13% chance of relapse rate. For children with APL, it is just recommended for them to fight it off, just to clear the cancer out of their body. APL is not a contagious disease. It is found in a gene that's located in your bloodstream. But acute promyelocytic leukemia is a cancer that can be passed down to offspring. Victims suffering from this disease have many websites that they can look at if they need support. Plenty of different sites are available to look at if they're concerned or curious about this disease. And I know you guys are, so you better look at these websites at the end of this video.
Hello, this is Devin Allen, here to tell you the medical facts of APL. APL is an aggressive form of AML, which is a leukemia that occurs when there are too many immature blood-forming cells in both the bone marrow and blood. The two main genes that are affected by APL are the PML and the RA gene. This disease is found by taking bone marrow or spinal fluid samples. Some symptoms of this are nosebleeds, bleeding that is hard to stop, fever, paleness, lack of an appetite, and unexplained weight loss. The survival rate is 85 to 90%. It is often known as one of the most curable cancers.
Wow.
APL occurs in 1 in 250,000 Americans. APL is treated using chemotherapy, radiation, or stem cell research.
Wow.
Remission is likely, however, so is relapse.
Oof.
Some medicines used are cladribine, topotecan, and MTX. The medicines work by attacking any cell that is dividing quickly. It starts with the cancer cell, however, eventually, the medicines attack the healthy cells, causing hair loss, bruising, and fatigue due to the lowered red blood cell count. The life expectancy of a person diagnosed with APL is 8 to 10 years. There are only 6 documented cases of APL in patients over 60. The average diagnosis of a patient is 8 to 10, and it is not common in children.
This is Colin Jones here to conclude APL for you. Acute promyelocytic leukemia is a form of acute myeloid leukemia, which is a type of cancer of bone marrow. In regular bone marrow, hematopoietic produces red blood cells, which carries the oxygen. White blood cells, which protect the body from infection, and platelets that are in charge and most involved in blood clotting. But with APL, immature white blood cells, or promyelocytes, start to gradually increase in the bone marrow. Due to the increase of these promyelocytes, a shortage of the normal and regular white as well as red blood cells and platelets in the body begin to occur. This is the prime reason of the signs as well as the symptoms of this disease. People that have this disease bleed an abnormal amount, whether they have a really bad nosebleed or blood starts to flow from their gums, or even they somehow have blood in their urine. This strange amount of bleeding happens because there's a really low number of platelets in one's blood, well, in their blood, and because the cancerous cells release abnormal substances, which causes excessive bleeding. APL is amongst the rarest diseases, especially one of the rarest cancers. But what it makes people who suffer from it go through, it makes it one of the worst diseases. Bye!
These websites help us complete our research. Rarediseases.info.nih.gov, stjude.org, ghr.lnm.nih, medscape.org, cancer.org, and orpha.net.